The subjective examination of the patient. Patient complains to have a cramp-like pain appear at right calf during standing or sitting for too long. Next, patient also said that the pain has been gradually increased for the past 7 years, and the patient are suspected to have venous disorder of the lower extremity. Next, for the objective examination, the general inspection shows that the patient have circulatory disorder on the right leg due to hyperpigmentation of the skin, bulging of the vein on the right leg, and edema on the right leg during general inspection. Next, moving on to the respiratory system. The patient shows no sign of respiratory dysfunction. However, despite of any pathological signs, an X-ray must be done in order as a screening test. Next, for the cardiovascular system, the patient shows no pathological sign of the heart. However, upon inspection, the patient has signs pathology of the vein of the lower extremities, which is a varicose vein on the right leg. An ECG test must be done as a screening test. Next, moving on to the GIT system, the patient shows no sign of the gastrointestinal pathology. Next, moving on to the local status. The local status indicate that the patient has superficial varicose vein to the clinical inspection and positive test for cough impulse. The patient also have valve incompetence in according to the result of the Brody-Tan-Beluk test. The patient also has deep vein thrombosis due to the positive test for Hohmann test and also Moses test. However, the patient doesn't suffer any pulmonary embolism since the patient does have dyspnea, tachycardia, and swollen part of the left axillary region. Next, moving on to the lab analysis. The patient lab analysis shows that the D-dimer level increase, which indicate that the patient has DVT. Next, the instrumental test that the patient has done is phlebography, duplex scanning with color mapping of blood flow, Doppler ultrasound, normal chest X-ray, and also ECG. Both of them indicates are normal. And the preliminary diagnosis that the patient has is that the patient has deep vein thrombosis located at the right extremities inside the popliteal vein, and the thrombi is an occlusive thrombi. Next, the patient also has venous valve incompetence at the right extremities due to the positive Brody-Tan-Beluk test at great saphenous vein. Next, patient also has a varicose vein due to the appearance of the bulging vein at the right lower extremity posterior side of the cuff and presence of trophic ulcers. Next, for the treatment, the patient will be giving, for the deep vein thrombosis, the patient will be giving anticoagulants, which is heparin, low molecular weight heparin, and more suitable is actually fibrinolytics such as streptokinase, urokinase, and atiplase. And the patient also be given non-steroidal anti-inflammatory drugs such as ibuprofen, aspirin, and diclofenac. The patient also will be giving elastinoxins for the varicose vein and also for the deep vein thrombosis. And in surgical intervention, the patient will be given placement of the Gaffer filter, which reduce the pulmonary risk of pulmonary embolism. The patient will also be removed the thrombi by Fogarty catheter and placement of external shunt over the insufficient valve, which is also called external valvuloplasty. Next, on preoperative, the patient will be given consent form, and the day of the surgery is 24th of October. The planned surgery is placement of cover filter, removal of thrombus by Fogarty catheter, and external valvuloplasty. The planned anesthetic is local. The risk of surgery is moderate to high. The thromboembolic complication is high. The risk of bleeding complication is moderate, and there's no contraindication. The chance to succeed without surgery is 65%, and the chance to succeed with surgery is 90%. Next, the patient will be prepping for the surgery, which is the patient. So the place of the surgery will be prepped, and the patient will need to fast at least 6 hours before the surgery, which means no food and no water. Next, the patient will be given also. The patient will also be checked for their vital signs such as the pulse, the respiration rate, the blood pressure, the consciousness, and the temperature in the operation. The patient will also be given anesthetic according to how much do they need during surgery. Next, during the post-op, the patient will regularly be checking the vital signs such as the pulse rate, the respiration rate, the ventilation rate, the blood pressure, the consciousness, and also the temperature. The patient also will be checked on the site of surgery to see if there's any infection, and the patient will be regularly checked for bed sores regularly. The time interval for each inspection of the vital signs are 3 hours for the first 2 days, and also for the next day is 6 hours, every 6 hours. Yeah. And next, the patient for the pre-operative goal, the patient will be in NPO for 12 hours. The medicine will be given antibiotics for prophylaxis against infection, and analgesic to reduce the pain, and also anticoagulant to prevent coagulation. The catheter will be removed after 3 days. The NG tube will be removed after 3 days. The vital signs, as I already said, is we'll be checking every 6 hours. And the site of surgery is checked for presence of infection and condition of the dressing. The urine output, concentration, and color and presence of stones are also being observed. The patient will be using Foley catheter during the post-operative care. And also, the re-examination of the patient will be done in every 6 hours.